Muda, Muri, and Mura are called the 3 M's. These three Japanese terms were developed by Taichi Ohno to describe different types of wasteful activity. Muda means unnecessary and reflects the so-called 7 types of waste that we will be talking about next. Mura means unbalanced or uneven. Fluctuation in customer demand, variation of cycle times for different operations or operators are examples of mura or unevenness. Haijunka, which is a Japanese word that means leveling, is a concept that addresses mura by creating consistency or evenness. Muri means to overburden. When people or machines are utilized for more than 100% to finish their task, they are overburdened. This creates productivity and quality problems in addition to major employee dissatisfaction. Concepts such as standard work, line balancing, total productive maintenance, and several other tools and concepts can be used to address Muri. As he began to develop what is now known as the Toyota production system, Taichi Ohno identified 7 wastes that are considered Muda. These wastes are all related. As you begin to identify examples of these wastes, you will see the relationships between them. Ohno often would draw a circle on the factory floor and have newly hired engineers stand in the circle and write down as many wastes as they can observe. The wastes Ohno identified were overproduction, waiting, transporting, inappropriate processing, excess inventory or storage, unnecessary or excess motion, and defects. Let's examine each of these wastes in some more detail. Overproduction is producing work or providing a service that is either not needed or producing it before it is needed by the customer. Taichi Ohno considered overproduction to be the chief waste because it amplifies all of the other wastes. Examples of this in a clinical setting would be things like treatments given too early due to staff scheduling and unnecessary testing being done. An example on the administrative side might be providing extra copies of reports or emails to people that do not need them. Waiting is a twofold waste. People can be waiting for tools, materials, information, etc. Product, information, or customers, such as patients, can be waiting. If you were to follow a patient through a process from when that patient enters a hospital for a procedure to when he or she exits, you would find most of that time the patient is waiting. The same is true of information and paperwork in a process. Transportation is moving material, information, or patients. When we move anything or anyone from one area within a facility to another, it does not add value for the customer or patient. Obviously, there must be some movement, but lean thinkers work to minimize the amount of transportation through things like improved layout. Inappropriate processing waste is waste within the actual process in which work is being done. Examples include readmittance of a patient into ICU because of an error, using the wrong type of tool or equipment, using the wrong type of software, for example, using a spreadsheet program for a database, using workarounds, redundant data entry into multiple electronic or paper-based systems. Excess inventory is defined as any product or information stored in quantities beyond what is actually required. In healthcare, this would include things like supplies and either electronic or physical information and paperwork. It could also be extended to include the storage or waiting of patients. Motion waste involves primarily walking and searching, but also could include unsafe motion such as bending, reaching, etc. A certain amount of motion is necessary to do the job. We must move to obtain tools, supplies, or other items we need to add value. In lean thinking, we work to minimize motion to as little as possible. We do this by placing all needed items at the point of use and eliminating wasted time and motion searching for items. Examples in healthcare include searching for supplies or information such as charts, walking to find another individual such as a doctor, patient, or nurse. Defects or errors result in additional cost at the very least. Worst case in healthcare, they can result in preventable deaths. Quality at the source is a pillar of the Toyota production system. In lean thinking, we work to eliminate errors and defects by mistake-proofing processes, preventing errors from occurring, and utilizing our problem-solving process. James Womack and Daniel Jones identified an eighth waste in the book Lean Thinking: underutilizing employee ideas and creativity. Rather than simply asking our employees to assemble this product, operate this machine, or perform their task, we should be teaching them how to identify and eliminate waste and asking them to do it and empowering them to do it. No one knows a process better than the person who does it every day. So it makes sense to involve such people in continuous improvement. Let's look at an example of the elimination of waste from a healthcare organization. There was a 13-month lean healthcare transformation in the National Health Service primary care health visiting services in the United Kingdom from May 2008 to June 2009. This process map shows the previous state patient pathway from receipt of new birth notification to the first patient visit. There are 67 steps in the process. What were some of the wastes identified in these processes? They included time waiting for a computer, playing phone tag, filling in forms, deciphering client notes and handwriting, searching for patient notes, traveling to failed visits, booking and rebooking meetings, and dealing with faulty IT equipment. There were only a small number of value-added tasks in the process and a number of business essential but non-value-added tasks. In lean thinking, we streamline these tasks so that they waste the least amount of resources. After eliminating waste and streamlining the activities, the redesigned process map has only 24 steps, a reduction of steps by nearly 65%. In the previous condition, 15% of the clinical staff's activities were waste, and 46% of the administrative staff's activities were waste. The next steps for this organization were to standardize processes, simplify standard tasks, and redirect freed-up resources to provide better direct care to patients. Get a group of employees together and take a walk through your process, whether it's a manufacturing process, business process, healthcare process, or otherwise, and see how many of the 7 wastes you can identify. Write them down and begin thinking through the process of identifying why they occur and eliminating those wastes.